Welcome to the Virginia Association of Naturopathic Physicians webinar, panel discussion on immune support and resiliency. This will be a panel discussion from naturopathic doctors throughout Virginia. Questions can be submitted using the question mark icon throughout our discussion, and questions will be answered at the end of the webinar. Dr. Sarah Giardinelli will be moderating the discussion. Dr. Sarah is president of the Virginia Association of Naturopathic Physicians, which is hosting tonight's webinar. She is also the founder, naturopathic doctor, and acupuncturist at Collective Health Center. Dr. Sarah has been caring for patients in Northern Virginia for the past 8 years, first at Nova Medical Group, then Innova Medical Group, prior to starting her own Collective Health Center 2 years ago in Leesburg, Virginia. Her focus with patients is personalized health, and her goal, one patient at a time, is community health. She holds her Bachelor of Science in Psychology from the University of Buffalo and Doctor of Naturopathic Medicine and Masters of Science in Oriental Medicine from the National University of Natural Medicine. She enjoys research, reading, and writing, and serves as health editor of Loudoun County Magazine. I'll hand this over to Dr. Giardinelli. Dr. Sarah?
Thank you, Baron. I'm glad to be moderating this discussion tonight. I'd like to take a moment to thank everyone for joining us and to thank my wonderfully talented colleagues for taking the time to be part of the panel this evening. I would like to preface our discussion by stating that at this time, there are no known preventative measures, treatment protocols, or cures specifically for COVID-19. The focus tonight will be on immune support and resiliency, what we can do to stay healthy and strong during this time. Without further ado, I am pleased to start off our discussion with Dr. Leah Holland. Dr. Holland holds a Bachelor's of Science in Psychology from Virginia Commonwealth University and a Master in Public Health from VCU School of Medicine. Dr. Holland completed her naturopathic doctor degree and residency training at National University of Naturopathic Medicine, or Natural Medicine, and also served as an assistant professor of pharmacy and is co-owner of Richmond Natural Medicine. She has been editor for the American Journal of Pharmaceutical Education and has been published in the use of alternative medicine and assistant in the establishment of a drug court program in Central Appalachia. She has an extensive history of working with patients who have unresolved trauma or PTSD and supporting patients in their healing from trauma. She is passionate about fostering and encouraging the development of future clinicians, where she serves as the residency site coordinator for the first accredited naturopathic residency program in Virginia. She presents nationally and internationally on natural medicine, pharmacology, trauma, and genetics. Given her strong background in public health, Dr. Holland will be sharing some of her insights with us this evening. So starting off, Dr. Holland, can you speak for a moment on the transmission of COVID-19? Oh, hold on a moment, Leah. I'm going to unmute you. There you are.
Wonderful. Thank you so much to everyone for being on here. Yes, I'd love to talk a little bit more about the transmission. I still think that there's some confusion and also some new things that we are learning. So most people do know that it is transmitted through droplets, particles that are less than a certain size. And we've known that for some time, but as many people have been seeing, there's quite a bit of information out there about it staying on surfaces. So lots of different types of viruses can remain on surfaces, even like hepatitis B, and for quite some period of time. Some people have looked at paper, plastic, metal. There's different lengths and periods of time. But the big thing is this is why we don't want people touching their faces. So I'm going to try to not touch my face. I know this is a big thing for all of us. I mean, we're all trying to do our very best. So this is one of the ways that transmission can happen, is because when we touch our face, it gets those microbes closer to the mouth and to the nose, and so we don't want to do that. But as far as other viral shedding, what has been very interesting, I think, is we definitely know that this virus is shedding through other means. And you can look at some of the cases out of China. We definitely know that it's shed through feces. We can even talk about possibility of it being airborne. And I know that this is something that the World Health Organization has done a number of studies showing that that is not the case. However, there are some new studies showing that it could actually be airborne. And so I think that whenever we have a new virus or there's something new that's out there, we have to just keep our eyes open and remain vigilant about things and just be cautious. You probably heard, some people have heard about some of the cases around people being in quarters and keeping that separate, that distance that we like people to have, at least that 6 feet of distance. But even with that choir practice group, you actually saw that there were a number of people who actually got this. And so I think we just need to be diligent. And this is why a lot of the things that each of our state governors are putting into place, our own governor is putting in place of trying to decrease the transmission.
That leads perfectly into my next question for you, which is, why are the current public health guidelines in Virginia and throughout the country so essential? Why are these naturopathic at heart?
Yeah, that's a great question. Well, I think one of the biggest tenets, if we look at a lot of our tenets, it's doctor as teacher, right? So a lot of the things that we learn as physicians is we want to teach our patients that. And so we also believe in treating the cause. And so this is what we're trying to do as a state, is that we're trying to stop the spread. We're trying to treat the cause and from it going to other people. But I think it also is about us treating the whole person, right? So not everyone who comes in contact with it is going to have these extreme symptoms. They may just be a carrier. So we have to really make sure that we're treating the individual person as well as the whole cause, and then the holism piece of it, of we are all connected, right? And so we have a lot of work to do as far as individual medicine, and then also population medicine, even from what you guys have probably seen the news about those people who are at a higher risk. Each person is unique and we want to really tailor to them. I actually had written something to Dr. Sarah earlier about when I was a kid, my parents had these books that they got for me, and it was about different diseases and different doctors and also people who looked at medicine. And one was Jon Snow, and not Jon Snow of like Game of Thrones Jon Snow, but Jon Snow who actually found out about, he was responsible for determining the cause of cholera back, in the 1800s. And this is what we're still trying to do, is if we understand the whole system, if we're looking at everyone and also the person, then we have a much better ability to try to figure out how we can engage with this in an appropriate manner. So this is why, like, our governors are saying, please stay home, wash your hands, keep your hands away from your face. We're trying to decrease this transmission for especially those people who are most vulnerable. And so by staying home, we're saving lives. And that's really what this is all about, is that we are all connected in this.
Thanks so much. Next question is, aside from 20 seconds of vigorous hand washing and sanitizing hard surfaces often, what are some other areas of hygiene often forgotten that you think would be good reminders for folks?
From what I have seen thus far, I think a lot of people are forgetting to take care of their electronics, screens. If you think about it, if you have a computer in front of you or your phone's near you and you sneeze, it might not be something that you think about because it's just, quite around you. But I think also, making sure that you do that at least once a day, I think that's helpful. Your phones too. I like to tell people to also do remote controls. That's an easy thing for people to forget. Trash cans, faucets, but the steering wheels are also really helpful, because at least for me, if I'm going somewhere, it's the car and it's pretty much home, and we need to just remember that we've been out and about. So I would love for people to do that. Wash your hands before bed. That's another thing that you can definitely do. And then also going back to specific medicine for individuals is, there's still many people working in warehouses, shipping all kinds of different things. There, shipyards, that, all kinds of stuff. And so it really depends on your risk. And so for some people, we know around fomites, these things that carry or can hold the virus for some period of time, is that, we want to be diligent, but we don't want to be having an unhealthy hypervigilance around this, right? Like, we want to be mindful and intentional about what we do. So if you have a loved one who's in your household and they're working at a hospital, if they're working in a warehouse, you do want to take some precautions. You can always definitely, if you have a space, you could leave your shoes out there for a little while. You could, air out a jacket if you need to. And of course, taking your clothes off and washing them right away if that's the case. I also like people to think about gargling salt water pretty regularly, or also doing nasal rinses. I think that's very helpful. Even Listerine or some other type of thing that's out there, you could also use that to try to help with any of that type of maybe some form of infection that might be in the throat. I think just trying to keep those nasal passages in the throat healthy is important.
Awesome. What are your favorite products that are FDA compliant, high level disinfectants or that you might recommend?
Well, there's a number of different ones out there. And of course, even the World Health Organization has listed a number of different products that are easy to get in a household. Anything from isopropyl alcohol that's greater than 70% to wipe down surfaces. We can also use hydrogen peroxide and even bleach. And so there's all kinds of different recipes out there. But of course, the World Health Organization and also the CDC have that listed. If you've got bleach in the house, that is an easy thing to use. You could do about 5 tablespoons or like a third a cup of bleach for a gallon of water, and that's quite easy. Even the World Health Organization has a recipe for hand sanitizer if you're interested. I did do this because, like many people who have had a clinic for a while, we didn't have some things that we took for granted. And so I did make my own for my own personal use, but I did use the whole alcohol 70%, and then I added in vegetable glycerin, and I added in also some essential oils. And actually, if you go to the CDC, FDA, they have listed a whole battery of different disinfectants, and thymol is on there, our beautiful thyme. So if you wanted to also maybe throw that in for a little bit of smell, that can be helpful. And if you're afraid of your hands drying out, you could put a little castor oil in there.
Awesome. I know a lot of the messages we've been hearing are repetitive, but I think some of them are really worth us hearing again. From a public health standpoint, what are some things you think are worth repeating here tonight?
Yeah, I think there's a number. It's so hard for everybody to keep up, and thank goodness we have wonderful colleagues, and we have great, we've got a lot of wonderful colleagues from all over the globe that are sharing information. But I do want to share this, is that you really don't, I know that the criteria says fever, but there are a lot of people not getting a fever. There are a lot of people who can't get a fever. And sometimes as we age, it's even harder to get a fever. And we know that a large majority of people who were leaving Wuhan who actually did have other symptoms did not have a fever. And so a number of individuals are not getting tested because they've been told, unless you have a fever, you can't get tested. And then if some do have a fever, if you don't have a fever over 102, we're not testing you. So this is one thing that I really want to drive home to people, is that if you have the other symptoms, like, try to find somebody who will take this seriously and just stay on it. So the second thing I also think is really important for us to consider is the long-term sequelae, or the long-term things that we're looking at as providers in every state, or I should say, practitioners, people in the healing arts, is to remember that it's not just about getting through this acute illness if and when people get it, but it's also recognizing that there are side effects long-term. People can have pulmonary fibrosis, so it's like a lung damage basically. And so we're going to be looking at this for years in the future of trying to help them, and that's one of the things that we need to do. But I think what's interesting to share around this is that even in New York, and a number of the ERs, if they had actual car accidents, they were bringing people in for a chest x-ray, and they realized these people didn't have symptoms, but they had COVID because they had pulmonary fibrosis. So I think it's not so much about, it's not about people feeling scared, it's about people feeling prepared. And recognizing that we as people in Virginia, as citizens, but also the people that are out there listening to us today, it's important to take care of yourself. If no time is better than to start taking care of yourself if for some reason you've forgotten or you had other things going on. So I wanted to share that. And then also about the various routes of transmission, I think that that's another thing I like to keep people thinking about, is that we just want to remember that we're still in our infancy of understanding this virus, and we just want to be mindful. I think it's important. And that's, again, back to why our governors, especially Governor Northam, who is a physician, and I think that he has a very good sense of things. It's wonderful actually having a physician as a governor. I'm very grateful for that. Not every state has that. The other thing that I want to share with people that I think is fascinating, at least to me, maybe it's the nerd in me around epidemiology, but is that I'm thinking a lot about our frontline providers and recognizing that, you know, they are definitely putting themselves on the line for all of us every day in ways that they never thought maybe that they would, at least in this lifetime. And to think that there might be a viral load exposure, right, or the exposure load. And so we might think about exposure load when we think about people who work in radiation or those kinds of things. And what we're seeing is that in our hospitals, when we have providers who are ongoing, taking care of the sickest patients, having exposure after exposure after exposure, we don't know what that cutoff would be for them. And so, you know, for us as naturopathic doctors and people who care about natural medicine and about our communities, is that we want to be as supportive of our frontline providers as possible. And is there a cutoff point that we may not know is there yet? But it does look like that from looking at a really interesting, if you're interested, there's a article that came out in the New Yorker that was written by a physician who's also a virologist, and he had a very interesting way of looking at this. And so I think that that's what they were showing, is that just slight contact, you're not going to have a lot of symptoms, but if you have overexposure, you're going to have a lot more symptoms. And we have seen that with our frontline providers. A couple other things just want to tie up, and then we're going to pass it over, is we've kind of been expecting a pandemic for decades in public health. It was something that we have expected for quite some time. And so we knew that this was possible. So we really need to take public health seriously. And I know in other countries that have more of a closed society, they think about the whole. Again, back to that holism, and they realize that they respect their elders, they love their elders in ways that maybe some other countries, that hasn't been, you know, they haven't had that long-term ancient understanding and reverence for their elders. And I think that that's why certain societies may be taking this a little bit more seriously, maybe than some other countries. And with this, I think immunity is key. We are probably all going to be exposed to this, and we need to recognize that we need to be very intentional about how we go about our lives, and recognizing that there's something that we can do to better take care of ourselves, to be a better steward to our community. And so this is why getting the antibody testing long term is very important. We want to know who has immunity, we want to know who doesn't, and who are the people who can go back to work. So those frontline providers that are sacrificing so much each day, you know, we want to figure out who actually is okay and who's not okay. And that also affects even restaurants and daycares and things like that. So I just wanted to put that out there. Hopefully we'll be seeing that more and more. And then if you happen to get sick, what we have seen in the research is the day 5 through 9, those days 5 through 9 are the most critical. And what I've been typically seeing is about day 7 and 8 are the worst for people. And that's what we've seen even in the research in Wuhan, and also in parts of New England, and even into New York, is that is the critical time. And so you don't get cocky and you don't stop what you're doing to take care of yourself. You need to really be mindful and aware and very intentional. So we're in this for the long haul. I keep telling people that it's like a pregnancy. We just found out at 6 weeks in or whatever, and we're in it for the whole gestational period. So do what you can to take care of yourselves, rest frequently, eat well. And then into that, and I know that Dr. Marie is going to talk about this later, is about public health of our mental well-being. You know, I know that there's a lot of fear out there, and we have to remember that our ancestors walked the face of this earth and had pandemics, and we're here. And we just have to remember that we can do this, and that resilience lives in each one of us. And so that's why we rest, and that's why we eat, and we take care of one another, and we stay in our lane. It's like I-95. Nobody really likes to get on I-95. And if you're listening on the West Coast, nobody really likes to get on I-5, right? But sometimes we have to do it. and then there's somebody zipping in at 90 miles per hour, and you're like, you stay in your lane. And then if somebody has wrecked on the side of the road, you don't rubberneck. And that's the goal, is we stay in our lane, we stay composed. If we need to get off at the exit and rest, we do that. We're all connected. Thank you so much for having me.
Thank you so much, Dr. Holland. Really appreciate you sharing your insights, especially from the public health perspective. Our next speaker is Dr. Robert Boyd. Dr. Boyd will discuss nutrition to support and bolster immune health. Dr. Boyd is co-founder of Terrain Clinic, located in Alexandria, Virginia, and focuses on thyroid disorders, fertility, and men's health. He also has interests in digestive disorders and immune health. He graduated summa cum laude from the University of Bridgeport College of Naturopathic Medicine and completed residency at the Center of Excellence in Generative Medicine under the tutelage of Dr. Peter D'Adamo. He is also an adjunct professor teaching nutrition and diet therapy at Trinity Washington University. Thank you so much for joining us tonight, Dr. Boyd. And so to start you off, I'm going to ask, what diet is best to support immune health?
First of all, thank you so much for having me on. I'm really excited to be here and be a part of the team, and really excited to talk about something that's near and dear to my heart, which is nutrition. And so to get to your question, what is the best diet for immune health? As with nutrition, it's always not clear cut and dry, and there is no perfect immune system diet, right? But there are aspects of our diet that we can focus on and make sure we're doing everything right in those areas that can really support our immune system and make sure that our immune system is up to fight if we do contract something, and B, we're in the best possible position to be in it from a more preventative perspective as well. And so I always like to kick things off when we start with diet is talking about the most basic and fundamental thing of all, and that's water. Water is an incredibly important thing that we should all be consuming a good amount of every day. And I'll grab my glass here in just a minute. But even more so than the beneficial effects of just being hydrated, water can act as a mucolytic, which means that it helps with making our mucus less thick. It helps with expecting that. It also enhances our circulatory processes. It improves all of our cellular cleanup processes, and really every aspect of our health is improved when we're well hydrated. And so a lot of times people struggle with, okay, well, how much water should I be drinking? Am I doing enough every day? A good rule of thumb and a good kind of guideline to go by is that if you take your weight and then you divide that number in two, and that's how many ounces of water you should be drinking per day. And so, for example, if you weigh 150 pounds, you should be drinking about 75 ounces of water per day. And so I always tell people, go out and make sure don't go out right now, but hopefully you have a water bottle at home that you enjoy, and maybe it's 24 ounces or maybe it's 32 ounces. And then you say, okay, I know I need to drink 3 of these per day, or I know I need to drink 4 of these per day. And so that's a really good guideline to give people, because hydration is one of the most critical aspects of our health, and it's often something that's really overlooked in a lot of times. Furthermore, something that we can also do, so one of the biggest sort of things that we eat that can be detrimental to our immune system is a lot of sugars and really simple carbohydrates. There's a ton of research out there that shows that even something having 100 grams of simple carbs per day, which a lot of people on kind of a standard American diet do, reduces the ability of your frontline immune system, your neutrophils, which is kind of like your first line of defense of your immune cells. It reduces their ability to kind of clean up and what we call phagocytize different bacterial components or viral components. And so if we're eating too much of those simple carbohydrates in terms of sugars or really refined carbohydrates like white bread or things like that, it can really dampen our first line of defense. And this can actually occur. So it's been shown that up to within 30 minutes of eating that large dosage of carbohydrates, up to even 5 hours after, we see that diminished ability for the immune system to perform those really basic kind of frontline defenses. And then things that you can do. So if you are starting, just from a general immune support perspective, if you are feeling under the weather, following a very kind of basic diet or even doing some short-term fasting can actually be incredibly helpful for your immune system. And so when we say a very simple or basic diet, what exactly does that mean? So that includes things like broths, soups, bone broths, lighter foods, vegetables. fresh vegetables, lower glycemic fruits, so you don't get all that carbohydrate. So things like berries, grapefruit, apples, pears, things that are lower in the glycemic index. All of those things that are more light and easy for our body to digest, it allows our systems to focus elsewhere in terms of if you are coming down with an illness, it allows your immune system to focus on those different areas that you need to be focused on. And then lastly, if you do have known food allergies or food sensitivities, it's important to avoid those things, obviously all the time, but especially if you are feeling like you're coming down with something and not feeling up to your best. When you're eating things that tend to activate your immune system, for example, it can increase your inflammatory cytokines, and that can really ramp up your inflammation overall. And so we want to, make sure that we're eating lightly and eating things that support our body. And then, I mentioned fasting as well, beyond just eating a simple diet. So first and foremost, you want to always communicate with your doctor and make sure that fasting is safe for you. There's, certain conditions, things like diabetes or other conditions where blood sugar control can be an issue, and you don't want to just embark on this fasting process without having someone to guide you through that. But fasting does increase your immune cells' ability to phagocytize those foreign organisms, so the ability to fight them and take them up and get rid of them. And it really shouldn't be done for more than 48 hours, though. So we're talking about short-term fasts. So that would be maybe, doing either an intermittent fasting protocol where you kind of condense your eating window to 8 hours, or maybe even just doing a full-on kind of light diet during the time that you are actually feeling ill. And once again, these are all things that are good, even outside of this, just for general immune health too. And so, yeah, that would be just some sort of basic dietary things that you can do.
Awesome, thank you so much. Next question is, what are the best foods to support lung health? As Dr. Holland mentioned, the lungs are really a sensitive organ system, especially to this particular virus and to many different viruses, including influenza. So it's really essential that we support them. And how can we do that dietarily?
Yeah, for sure. So always go back to my hallmark, water, right? So water is incredibly important for the health of your lungs and the mucus in your lungs, being able to clear that out and being able to thin that out. Foods that are rich in vitamin C, so good fresh fruits, vegetables, any of those vibrantly colored fruits and vegetables. We talk about eating the rainbow, so trying to eat a wide variety of colored fruits and veggies per day. Those are all rich in vitamin C and antioxidants. Foods that are rich in beta carotene, which is you're going to be getting into the vitamins and minerals and supplements and everything, Dr. Giardinelli, but foods that are rich in beta carotene, which are orange foods, so that would be things like carrots or sweet potatoes. Those are also really great for your lung health. And then some kind of general foods, also onions and garlic. Those have good antimicrobial properties and they can be helpful. Honey can be very helpful for the lungs. So once again, making sure to not overdo it with the carbs, but honey can be very helpful in terms of soothing if you have some lung irritation going on, and it also has those good antimicrobial properties. And then lastly, things that can kind of open things up and help you with breathing. Peppers are actually quite helpful. So the capsaicin that are in peppers, as long as you can handle, even if you're just doing bell peppers, for example, they do still have a little bit of capsaicin in there that can actually help with opening up the breathing pathways and opening up all your bronchioles and whatnot.
Awesome, thank you. Curious, is there any evidence-based for immune supportive effects of chicken soup?
Yes, so we get this one all the time, and I love talking about it. So there is actually some evidence out there for it. It's very common. You can think back to your grandmother telling you to have chicken soup while you're ill or things like that. And there actually is some research that has shown that there are beneficial effects when someone is ill to actually eating chicken soup, and it does have an effect on the body's inflammatory response. And so what the finding was with this research is that it had an ability to inhibit excessive amounts of inflammation that were occurring without completely suppressing it. And so if we think back to when someone is ill, the rampant inflammation is what generally causes us to have really severe symptoms. And we don't want to fully suppress that by any means, but if you can help to control that a little bit and bring it down, it can help from a symptomatic perspective quite a bit. And so the chicken soup was actually shown in vitro studies, which is in cell cultures, but it still has some evidence that it was actually able to reduce that inflammatory response and bring it into normal limits without completely suppressing it. And if we think about just kind of the general components of chicken soup too, so first and foremost broth, right? It's very warm, it's hydrating, it clears out the nasal passages. The vegetables in there have all kinds of awesome phytonutrients, things like carrots, celery, onions. Those are all rich in vitamins, minerals. The chicken is a great source of clean protein for people. And then it usually also has a rice or a noodle in there that is a good source of carbohydrate to give us energy. And so, yeah, there is actually some evidence in terms of research as well as all the anecdotal past of uses.
Wonderful. Wondering if you have concerns for vegans or vegetarians during like a viral pandemic and how they might be able to alter their diet accordingly.
Yep. So vegans and vegetarians, you know, everyone has their reason for doing a particular diet, and those are great diets for people to follow if they are wanting to do it. But there are a couple of things that they want to make sure that they're emphasizing. And so, you know, first and foremost, we want to make sure that they're getting adequate protein. That's obviously kind of the long standing concern with those diets. And so, the first plant-based protein that is actually the most complete protein for vegetarians and vegans is soy. So that, you know, that is a complete protein for them. Some people don't want to eat a lot of soy, or they don't tolerate it well. And so they also want to focus on protein combining, which is when you combine things like rice and beans, for example, they both have beneficial amino acids in there, which is what makes up the proteins, so that you're getting a complete protein. So you want to make sure you're either combining your protein sources in terms of using rice and beans, or grains and vegetables, or grains and nuts and seeds, just getting your protein from a variety of sources, or you can also make sure you're eating enough soy to get good protein. And then a couple of vitamins and minerals. So B12 is always a concern with making sure that vegans and vegetarians get enough of that. Generally speaking, if they're eating fortified foods, so that would be like fortified cereals or things like that, they'll get enough from that. But sometimes supplementation is necessary. Iron is important. They can get iron from leafy greens, legumes, and grains, but and also cooking with a cast iron pan can help with increasing iron content. And then lastly, zinc can be a little bit of a concern too, and we know that zinc has good antiviral properties and immune stimulating properties as well. So we want to make sure that they get adequate zinc, and so you can get those from legumes, nuts, and seeds, or through supplementation as well.
All right, and I was just wondering if, lastly, if you have any other diet-based approaches or suggestions that have good evidence for immune support, especially for viral upper respiratory tract infections.
Yeah, absolutely. So it's funny, Dr. Holland, you mentioned thymol, right? So one of the things that we usually tell people, especially, you know, just for general immune support, is to cook with your good herbs and things like that you use in the kitchen. So using oregano while you're cooking, rosemary, thyme, garlic, things like that, things that naturally have good antimicrobial properties and immune stimulating properties are all awesome to continue using during this time period. And then also using things like herbal teas. So the warm water from herbal teas actually has a good beneficial effect in terms of opening up all of our nasal passageways in our lungs and our bronchioles, and so that can be quite helpful. There's actually research studies showing that if someone's sipping on hot water as opposed to using a straw to drink hot water, the sipping action actually opens up all of those passageways way more sufficiently than actually even using a straw. And it also helps with a marker that they use to measure that is called nasal mucus velocity, which isn't a fun term or anything, but it helps with actually the clearance from your nasal mucosa. And so it actually helps with clearing things out and getting those out of your system. So, you know, warm teas, warm water, antimicrobial herbs, and then keeping the diet nice and basic, using broths and things like that, like we've talked about, are all great things to do.
Awesome. That's a new term for me. Nasal mucus velocity, was it? Excellent.
Yes.
We're going to put that into the rotation. I love it. Thank you so much, Dr. Boyd.
Yep.
So now I'm going to take a moment to discuss some key supplements for immune support before moving on to our next presenter. And so I'm going to ask my own questions, I guess. So what are the immune supportive benefits of vitamin C, vitamin D, vitamin A, and zinc? So vitamin C, or ascorbic acid, as most of us know, is really essential for our immune health and vitality. Both humans and primates are unable to synthesize it in our bodies. So we've got to ingest it. We have to eat it. So foods high in vitamin C include kiwi, fresh or frozen strawberries, fresh papaya, sweet red pepper, broccoli, and Brussels sprouts. Vitamin C is also known to lower histamine levels, which is not only helpful during allergy season, which is right now, but high levels of histamines are actually associated with adverse outcomes and many different types of disease processes, including cardiovascular disease. Some really interesting research coming out of Sweden links high pollen counts to worsened innate immune defense against respiratory viruses. And they are also studying this in relation to the novel coronavirus as well. So even for those of us with tolerable, quote unquote, I have a lot of people say, I've got allergies, but they're not too bad. It's really important for those of us, even with mild allergies, to make sure our immune response is being managed. So additionally, vitamin C in the form of ascorbic acid is shown to be helpful in balancing the inflammatory cascade involved with acute respiratory distress syndrome, which is a complication of this particular novel coronavirus, COVID-19. There is some strong evidence provided by a meta-analysis just published on March 30th by the Journal of Intensive Care that oral and IV vitamin C usage can reduce the duration of mechanical ventilation in critically ill patients. And another meta-analysis from March 2019, published in the journal Nutrients, indicates a near 8% reduction in length of intensive care unit stays. So it's an affordable option with low side effects. And this might be a consideration amongst other tools available to our emergency and intensive room physicians. And our profession is doing our best to get the word out to our medical colleagues who are on the front line of the pandemic about that option. Vitamin C can also help to manage our stress response. And who is not stressed right now? I'd like to note that. The adrenal glands, which are the walnut-sized organs that sit on top of our kidneys and help to manage our stress response, have the highest concentration of vitamin C of all the organs in the body. Ascorbic acid is a cofactor required for the production of catecholamine biosynthesis, including serotonin, norepinephrine, epinephrine, and dopamine, which are responsible for our energy levels, attention, and mood stability. And also the adrenal glands help produce the adrenal steroid hormones, estrogen, testosterone, and DHEA, and vitamin C is required in that production. Supplementation in levels significantly higher than the recommended daily values can help support adrenal function and decrease high cortisol levels. So vitamin C helps to build adrenal hormones when they are low and to lower them when they are too high. And our levels tend to get low during chronic long-term stress, kind of like we're all in right now. And the levels tend to go up when we're in more of an acute stress. So vitamin D. Vitamin D is not a strict definition of vitamin because it can be synthesized by the skin. When our skin is exposed to sunlight and makes vitamin D from cholesterol, the sun's UVB rays hit the cholesterol in the skin, providing energy for the vitamin D synthesis to occur. The best time for sun exposure is noontime, and 15 minutes a day is really adequate. Vitamin D is an immune and hormone modulator. Naturally occurring vitamin D is rare in foods. Sources do include fatty fish, such as from cod liver oil, pink salmon, fortified foods such as dairy and non-dairy milk, and smaller amounts are in eggs and beef liver. There's recent evidence that adequate serum vitamin D levels are important in protecting pulmonary function, so lung function, in those infected with influenza. So again, we're thinking about how we can protect our lungs, and vitamin D is really important in this. Vitamin D has been shown to lower viral load and decrease symptoms in infants with influenza. Low levels of serum 25-hydroxy vitamin D have been independently associated with serious adverse respiratory effects from influenza, whereas higher levels are associated with higher lung function. The risks to immune health appear to be most pronounced for those with deficiency. And there are many folks with vitamin D binding receptor deficiency, which is a genetic condition where vitamin D cannot be well absorbed into the cells. So if you know you have a history of deficiency or have been recently found with deficiency, you might check with your healthcare provider about strategies to increase your serum levels during this period of time we find ourselves in right now, such as a 10-day loading course with high doses of vitamin D3. And that is the best form of the vitamin D, the vitamin D3 cholecalciferol, which is available actually over the counter as a dietary supplement, whereas ironically, Vitamin D2, ergocalciferol, only being about 20 to 40% as effective in raising blood levels, is only available as a prescription. Vitamin D is a fat-soluble vitamin, so there are risks for toxicity, especially in infants and young children. But you kind of got to be really trying hard to get to toxic levels, but it is a caution nonetheless. Moving on to vitamin A. Vitamin A supplementation has been long known to help balance and bolster immune health, decrease inflammation, and optimize immune response to vaccination. Both worldwide, zinc and vitamin A deficiency are common causes for a variety of severe health conditions, including ocular and immune function. Low to middle income children are most vulnerable. So particularly in developing countries in Southern and Eastern Asia and Africa, and in Central and South America, deficiency is a serious nutritional problem where plant-based, lower fat diets are common. In my patients, I tend to see deficiency issues in some, not all, some individuals with vegan and vegetarian diets, and also in some individuals who have trouble converting beta carotene from foods Dr. Boyd mentioned, such as carrots and yams that are high in beta carotene, into vitamin A, and that's based on their genetics. One study I came across just today indicates that while zinc improves cell-mediated immune response in older adults, vitamin A supplementation, even at what levels I consider not that high, 800 IU per day, have the opposite effect in our elder population. So I thought that was interesting, something to keep in mind. Unfortunately, that was the only such study I came across related to vitamin A having maybe a suppressive effect in a certain age group of older adults. But for younger, for children and younger adults, it's quite important. Vitamin A also is also a fat-soluble vitamin. So again, there are risks for toxicity, especially to infants and young children. Again, you got to really be trying hard to do that, but it's a warning nonetheless. And also, it's not advised in higher doses for pregnant women because it can be teratogenic to the fetus, especially around the 8-week mark. So that's another note of caution. Now moving on to zinc. Zinc deficiency, even marginal, which is difficult to identify on serum testing, on standard serum testing, appears to reduce immune function through an overall loss of lymphocytes or white blood cells. Red blood cell and white blood cell tests are more useful to me clinically, although these can be cost prohibitive for many people. Zinc deficiency can lead to shrinkage of the thymus. That's the organ that controls the development of these important white blood cells. And that's through the loss of thymulin, the zinc-dependent hormone that is secreted from the thymus. Signs and symptoms of zinc deficiency include loss of appetite, growth retardation, sexual immaturity, skin changes, diarrhea, loss of appetite, loss of taste, hair loss, and immunological abnormalities. Zinc supplementation has been positively correlated to the prevention of pneumonia in children, and normal serum zinc levels have been shown to decrease incidence and duration of pneumonia in the elderly. So I consider zinc to be really, really essential for immune support during flu season, and especially during right now during this pandemic. Zinc levels are also essential for blood sugar support. Foods high in zinc include seeds, shellfish, and meats. And given the immune suppressive effects of diets high in sugar or carbohydrate load that Dr. Boyd discussed, now more than ever, it's important that we decrease the added sugar into our diets. Additionally, those who struggle with healthy blood sugar levels, such as those with prediabetes or diabetics, would do well to consider supplementation with their healthcare providers. And then my final question to myself is, what about N-acetylcysteine? And I just love N-acetylcysteine, otherwise known as NAC. This is a modified form of the amino acid cysteine. Again, it's one of my favorite supplements. It helps to clear histamine from the body. In higher doses, it thins mucus. So I call it a mucolytic, or it's known as a mucolyx. It thins mucus. It's a biofilm disruptor. So when we have bacterial load, we can get these films of bacteria that make it difficult to overcome bacterial infection. And this N-acetylcysteine kind of breaks through, helps to break up those biofilms. It supports healthy detoxification, supports healthy levels of neurotransmitter and hormone levels as well. So it's really has many different functions. And I love when you can take one supplement and it does so many wonderful things for the body with little side effect at all. I just love that. The N-acetylcysteine has been shown to also inhibit both H5N1, which is the avian flu viral replication, and H5N1 induced production of pro-inflammatory molecules in lung epithelial cells. So this particular supplement can really support lung immune health and has been shown to be a benefit in other types of viral illnesses. Clinically, for my patients with sinus or lung congestion, I found NAC to work very well to thin the mucus out, making it easier to blow or cough up mucus and expediting the recovery. And so that's what I have to say about some really essential vitamins and nutrients. And I'm going to pass the baton on to Dr. Brian Keenan. And Dr. Brian Keenan is a friendly naturopathic doctor and avid educator. He takes great pride in combining both current evidence-based medicine with clinical and historic use of medicine for both his patients and students. He's the owner of Magnolia Natural Medicine in Columbia, Maryland, with a satellite office in Fredericksburg, Virginia. He graduated from Bastyr University in 2016 and worked as professor teaching botanical medicine and pharmacology to naturopathic medical students before moving east to start his private practice. He is a registered herbalist with the American Herbalist Guild. And I am excited to discuss with Dr. Keenan botanicals that have some evidence-based for immune support. So your first question, Dr. Keenan, is, have any botanicals been researched in the treatment of COVID-19?
So hi, everybody. Making sure this is working. I know about a moment before we got started that there was over 90 people who were signed up for this. So just as I begin, I just want to say hello to everybody, and I hope you're doing okay. And thanks for being with us and pausing your Netflix binge. I do appreciate it. I will try to be as entertaining. When it comes, after I thought we were all coming together to talk about this Tiger King show that everyone's talking about, but let's focus on the task at hand. So, are there any botanicals that have been used to research COVID-19 or being researched to address COVID-19? The answer is yes and no, but the official answer is no. At this time, we do not have any research that says this herb or this botanical will stop the virus, will kill the virus, will do this. Those studies are currently being done, but it's an important filter that we have to have that says, like, don't jump the gun with botanical medicine because it can have a lot of it can create a lot of confusion. We'll talk about elderberry in a little bit, which is an example of how a lot of confusion came about. So officially the answer is no, and I did want to make that distinction, but they are actively using botanical medicine in most countries are using it. Most people in the world use botanical medicine in one way or another. And so we're starting to see the beginning of the research, but officially, no, it's not been studied yet.
What herbs have the most evidence-based and other strains of coronaviruses?
I know one is right here. My lovely licorice root. I'm almost out for my own stash. So licorice root is gonna be, if I had to pick one herb that wants to be a star right now, it's licorice root because it does so many different things. It's actually akin to that NAC you were talking about. It does so much. Licorice does a lot of things. It helps with energy. It actually supports the immune system. The immune system has been researched to be more active when there is licorice in the system. It's also directly antibacterial and antiviral to various disease. Again, you have to study each bacteria and each virus separately, but as a blanket statement, it tends to be quite useful. And you see it in a lot of cold and flu teas that are in the grocery store for that reason. And so it actually helps with digestive health as well, which is another, I think a lot of people are having trouble with digestion right now, actually just because they're nervous. They're just constantly ambiently nervous. And so licorice can actually be kind of helpful to appease that symptom. It can't fix the global crisis, but it can make your day a little bit better. Another herb that you're probably going to start hearing about pretty soon, it's a little bit unfamiliar in the West, it's very popular in the East, is an herb called blue plurum. So blue plurum right now, in Western herbalism, we've actually only really used it as a liver and a detox herb, which makes sense with, you know, if you have a virus or if you have a fever and your body's in a full immune reaction, you're going to have toxic particles being generated just from the battle. So I can kind of see it, but we don't really use it that way out here. But in the East, in Asia, it's getting a lot of hype. It has a group of chemicals called psychosaponins, and they seem to be very, very helpful as an immune stimulant and as a protective element. And then another one that has been researched for other coronaviruses is an herb called Chinese skullcap, or Scutellaria bicalensis. That one has to get a little special star or asterisk because people confuse it with Western skullcap, an herb called Scutellaria laterifolia. It's a different species, and you really want to make sure they do very different things, and so you want to make sure that you're getting skullcap bicalensis. However, the other skullcap is an anxiolytic, so it actually could be quite helpful right now, but not so much as a immune support piece, but more as a mind-body piece. And then the last one that I saw as I was going through the research that has enough trials is a good old-fashioned eucalyptus. So if you've got your essential oils at home, you've got your blends, throwing a few drops of eucalyptus into the diffuser is not a terrible idea. Will it make you immune and defend you and save you? No. But will it smell nice, smell fresh, and it does ambiently kill viral particles that have aerosolized? Yeah, it does denature them. So feel free to throw that in with your aromatherapy. So that's the research that I have right now that I've gone through.
Awesome. And I know a lot of people, probably most people on this webinar tonight have heard of using elderberry syrup for immune support or as an immune tonic, and might have heard some rumblings about concerns with elderberry syrup and, you know, can it create a cytokine storm? What is a cytokine storm? I'm wondering if you could address those questions.
It's a really important question. I'm glad you asked it. I'm glad we're talking about it. Because if I had one email that just repeats itself from different people, it's the elderberry email right now. And that's okay. That's great. I'm glad that people are thinking critically about using botanical medicine. So what a cytokine storm is when your body's natural immune system, which uses a thing called cytokines, as you might have guessed, and those are chemical signalers, and they kind of help with inflammation, but healthy inflammation. And the different cytokines do different things. However, in certain situations, people's immune systems can overreact. It is not unlike having an allergic reaction to shellfish. So much that all of this immune activity goes off and starts signaling rapidly. And you can have everything from a really bad fever and feeling nauseous and dizzy to it actually being deadly. It can be deadly. We mostly see this as a reaction to a bacterial infection. It can happen with a viral infection. And the third incidence of it occurring is actually from a drug interaction. So they're not particularly common, but they are very much a serious situation. That's cytokine storms. Where does elderberry play a role here? Elderberry stimulates the immune system, and we have research that actually has gone from in vitro to in vivo to human research that really demonstrates its ability to be very much stimulating the immune system. So what has happened is a very logical theoretical contraindication came into being. People said, well, wait a minute. Like if this can get the cytokine levels high, and we have research that says it can do that, higher, not high, then couldn't this like help provoke a cytokine storm, which is already an issue with the current virus of the day? And the answer to that is not really. That's kind of taking an herb and giving it like superpowers. Herbs are awesome because they are usually, not all herbs, but usually herbs are pretty gentle, they're pretty holistic, and they like provoke the body, and the body's own adaptive systems will keep everything in homeostasis. So you don't have to worry about like if I took that herb. Now again, there are certain herbs that you can absolutely overdose on. Elderberry really isn't one of them. The number one caution I actually have with elderberry ever is if it is in a syrup form or a honey form, keeping it away from children under the age of 2. And that has to do with botulinum toxin and actually how the elderberry is made, not the elderberries themselves. So right now I have to say it's a bit of a myth busted, but I'm really excited that people were so concerned because it means they're taking it seriously and they're thinking about how to be you know, how can I help my family the most? And elderberry is really out there and commercially. It's very commercially available. It's also very sustainable, so it's a great choice for a herb that everybody wants. So, you know, it actually, you know, because when we think about herbal medicine, we've got to think about sustainability. If the plants are healing us, we've got to heal the planet. So elderberry is really handy in that way. So that's kind of how it's shot to popularity.
Next question is garlic. Yes, no, or maybe.
Garlic all day, every minute of the day, like all the garlic. Let me just take a moment and follow Dr. Boyd's advice and have a sip of water. But anyway, garlic is not only been researched, and we've already talked about it for being really, really helpful, but it's just so good for your cardiovascular system, your respiratory system. Like that garlic breath, I know you don't like it, but it is a sign that you are like, it's going through your respiratory system. So like really, truly enjoy it. And garlic contains quercetin, which most people always associate with onions, but it's actually also in garlic. And quercetin as well has been studied by itself for all sorts of antiviral properties and anti-inflammatory properties. It's also really helpful for allergies because, of course, we're all dealing with what? Do I have the flu? Do I have allergies? Do I have COVID-19? Like, what do I have? I don't know. I'm scared. And then you get scared, then you don't sleep, and the immune system gets suppressed. And it's just a cycle. So one of the things that we can do is keep our food as medicine, like just tight in our hands. So making sure you're eating these high quercetin-rich foods, making sure you're eating a rainbow, all of that stuff is really important because we need all the different phytochemicals together to kind of bolster us to our best. And it's also just good for you, you know?
Awesome, thank you. What are your favorite lesser known herbs for immune support in upper respiratory illness or in a shortage of elderberry? What are some options that are easy for people to find, maybe even in their own backyard?
Yes, yes. So this is a great question. You know, obviously elderberry is there. We've talked about food as medicine, but let me just say it again. Garlic, onions, purple cabbage, purple grapes, red and yellow bell peppers, all of that stuff at the grocery store. Awesome. Some other herbs that are pretty popular that you'll see people using, and you'll see them if you buy something like a throat coat tea or a respiratory herb tea that's just out on the shelf. You'll hear about herbs like mullein, which is really, really good. Another great sustainable herb. It's great for children, so that's really nice. It's child safe. Echinacea, ain't nothing wrong with echinacea. Perfectly good herb to be utilizing right now. And so one of the things that I've been telling a lot of people, because I can talk about, you know, weird herbs like blue plurum, and people are like, I can't get it. And I'm like, okay, all right. So one thing that I always tell people is traditional medicinals, of which I am not affiliated, they're just in most grocery stores, have a seasonal pack that have 4 different types of tea in them. Just buy a lot of that. Yeah, yeah. Because it has all the different herbs that I could possibly possibly talk about right now, and if like you're not feverishly taking notes, you might miss. I know that we're going to work on a handout, I want to say, but in the future I'll get that. Anyway, so the traditional medicinals seasonal pack is really like the best thing you can get herbal wise. That's just like off the shelf, but any of your respiratory breathe easy teas are going to be just awesome. And then you're going to have that hot water and you're going to have that hydration that Dr. Boyd talked about. So like it goes very much hand in hand. And I think the last one that I want to throw out there is Tulsi or holy basil. Right now we're seeing the world do a lot of things. We are freaking out, but we're all coming together. Like, I mean, just across borders, across boundaries, we're all like, hey, we got to figure this out and work together. And this really is like watching humanity's heart sort of start to beat in one. And I know it's a little bit woo-woo, but just seeing the amount of humanity and the fact that most humans' response to this situation has been, I care about our health men and women. I care about our service people abroad. I care about all, like we care, and there's all this love. And so Tulsi is a really great herb that has a whole story about bringing people together and like being part of this tea that was shared amongst people religiously, and then it was just how it got its holy moniker. And so I just really recommend, if you see holy basil tea, go for it. It also has a few essential oils in it that are a little bit antimicrobial.
Thank you so much, Dr. Cannon. So next up, I am pleased to introduce Dr. Hannah Schmittat. She is a naturopathic doctor and licensed acupuncturist in the state of Maryland. She attended University of Bridgeport College of Naturopathic Medicine and Acupuncture Institute. She has studied native Jamaican herbs with Dr. Eugene Zamperone. Dr. Schmittat has a special focus on homeopathy, having studied the sensation style of homeopathy under Dr. Sankaran, a world-renowned homeopath. In addition to general family practice, Dr. Schmittat specializes in chronic and acute pain management. I am pleased to discuss with Dr. Schmittat the role of homeopathy in health. Thanks so much. The first question for you is, what is homeopathy and how can it be helpful for general health and for those who might be acutely ill?
Yeah, thank you for having me, and good evening, everybody. So that's a great question. Homeopathy is an energetic medicine that takes a super diluted form of any mineral, plant, or animal product and stimulates the body to start its healing process from inside out. So one of the principles by which homeopathy works is the principle of like cures like. And there's a really fun example that I like to use. Two examples actually. If you know coffee, if you're drinking concentrated coffee or maybe a shot of espresso, it gives you that sense of sharp, acute awakeness, the thoughts that start to flow. You have this sudden rush of energy that enters into your body. And if you drink it late at night, you will have a hard time sleeping. Right? So homeopathic coffee, which is the super diluted form of this crude form or the concentrated form of coffee, helps people with exactly this picture. So that's what we mean with like cures like. So it helps people who are going through perhaps insomnia, have a hard time going to sleep because they have so many thoughts happening late at night. Maybe they have this jittery energy and their eyes just won't cooperate and close and relax. So it helps in that way. Another great example is also the example of allium, which comes from onions, right? So if you're cutting onions and you're not wearing contact lenses and you don't have a mask on, and you're not wearing goggles, you start to have this watering of eyes and nose and perhaps even the mouth, right? Tears start falling out, not from sadness, but just from pure onions. Now, homeopathic allium helps people who are going through symptoms such as that, such as when we see people going through allergies, which is funny because this is allergy season. During allergy season, we have the itchy and the redness of the eyes. We have the watering, right? Your nose starts to become runny. There's sometimes a little bit of that itching inside the ear that you can't quite scratch. And there's more mucus being produced in the general head face area. So homeopathic allium helps in that symptom picture, such as spring fever.
Awesome. All right. How was homeopathy used in the last major pandemic, the flu of 1918?
Yes, good question. Okay, so the worldwide influenza epidemic of 1918 killed almost 22 million people worldwide, out of which 500,000 were in the US. So meaning the death rate was 30% or higher for those cases of the Spanish flu. Meanwhile, homeopathy was one of the mainly used remedies because at the time, homeopathic practices and outpatient clinics as well as hospitals existed throughout various different countries. And that brings me a little bit to my education back in India. There are still homeopathic clinics and hospitals in India, and it seems to be one of the first go-to, I guess, the first approach in health is homeopathy. So some of the homeopathic remedies that were used to help during the Spanish flu were gelsemium and bryonia. And I'll talk a little bit more in detail about those later. But those were some of the two main homeopathic remedies. Alongside other remedies, of course, you have to take the full symptom picture in order to determine which one is the most applicable homeopathic remedy for you. But it looks like it helped 98% of the cases in 1918.
Awesome. Thank you so much for sharing the history about that. Wondering what a few remedies are to support those with acute upper and lower respiratory illnesses, and what are the characteristics or patterns that we see with these remedies, so people might know, be able to understand better how to utilize them at home.
Very good. That's a good question. So I wanted to talk a little bit in stages, actually, because there are certain homeopathic remedies that are really useful for upper and lower respiratory illnesses, and depending on the modalities and the chronology, what happens first, what happens next, as well as the concomitants, meaning what is happening all together, in which different organs of the body is what happening. That'll determine which homeopathic remedy might be the most appropriate. But I wanted to talk a little bit about the genus Epidemicus. So what that means is it's the homeopathic remedy that has been chosen based on the combined symptoms of the large group of people afflicted with a certain disease or epidemic. So it's the remedy that covers all the symptoms of that particular epidemic, all bundled up together. So if you take 100 cases of, let's say, the flu, each person will present slightly differently, but there are certain commonalities and characteristics that will stand out that will be quite common in those cases. And then a homeopathic remedy which covers those symptoms, again, back to the concept of like cures like. If the homeopathic remedy in its crude form creates those symptoms, then the homeopathic remedy in its diluted form will help to, I guess, stimulate the body's vital healing forces to recover from those symptoms. So the genus Epidemicus, according to my teacher, Dr. Sankaran, for this current episode seems to be camphora, which is also interesting because you talked about camphor containing essential oils or plants, right? So those are the plants that help to open up the lungs and help you to breathe better, to open up the sinuses in the nose. Now, homeopathic camphor has this symptom picture. It's sudden collapse with cold sweat and relative absence of restlessness. So that brings me to another homeopathic remedy. I'll jump a little bit back and forth. Let me know if it's confusing. But restlessness is one of the key symptoms that's present in arsenicum, which is also a close remedy for upper respiratory infections and really useful in the beginning phases. But camphora has the absence, or there is no restlessness. Other key symptoms of camphora include nagging headache in the forehead, low-grade fever, perspiration in the upper body, shivering, chills, and extreme prostration, meaning the extreme tiredness, the collapse, the desire to want to lie down and not want to talk to anybody. Another thing is also the inability to sit, meaning not that inability to sit still because you're moving around, but the inability to sit because you're just so exhausted that you cannot even think to sit, that you want to lie down. Other things, weakness, irritation in the throat that causes the cough, which is a dry cough, cold hands, and touch aggravates, which means doesn't like to be touched. Everything hurts, which is also quite similar to the remedy actually quite the opposite of the remedy that comes to a close, not a close second, but is also a very useful remedy for upper respiratory infections, is bryonia. Bryonia has the characteristics of being bursting, stitching, heavy, sore, but at least they are a little bit better after lying down on that area that is painful. But they are averse to least motion, meaning they don't want to be in a car, they don't want to be in moving things. Back then, I think they used to have carriages, and the roads are kind of like Alexandria in that we have brick roads, and some of the brick roads are really old in that they're actually rocks, round rocks, that if you drive over, there's this funny jittery sensation that you're driving over something really uneven. So bryonia hates that, or the person who has the bryonia symptoms seems to hate that. The other reason why bryonia might be a close one for upper respiratory infections, especially during this time, is because they have this dryness everywhere, meaning dry cough, right? Which seems to be the current symptom picture of what's going around. All right, so back to camphora. Sorry if I'm confusing everybody. So camphora, the remedy that is for the sudden collapse, the prostration. And how we can use that as in this time period as a genus epidemicus is in 3 ways. So one is if you want to strengthen your immune system and build resiliency, and you're not having any symptoms, but you just want to build your immune system anyways, is you can take camphora 1M 4 pills twice daily for 2 days, and make sure that you're taking it 30 minutes away from all food except water. That's okay. And that's before and after meals, meaning to space out at least 30 minutes before or after the meal. And then secondary, if you feel like maybe the symptom picture seems to be matching and you want to stimulate your body's vital response, then you can take 1M 8 pills in 100 milliliters of water. So having a container such as this can be useful, or even a glass like this can be useful. If you can pour yourself 100 milliliters of water, you can put in 8 pills, or if you have it in a dropper, 8 droppers. So this is a dropper, and these are generally what the pellets look like. And to help in a severe respiratory infection, having a camphor 10M 8 pills in 100 milliliters of water, and taking 1 tablespoon every 6 hours for a few days until your body's response seems to be kicking in and you start to feel better, then you can decrease it to the frequency of just twice a day. All right, so back to that question. What was that question? What are a few remedies? All right, so some other really helpful remedies include Arsenicum album, where it's that feeling of being really chilly and exhausted and anxious and restless, right? Here's where I mentioned these are the differentiating factors. So if you have a person who is really restless, is experiencing a lot of anxiety, this feeling like impending doom, oh my gosh, I don't know, will I survive this or will I not? What about my finances? Then that remedy seems to be really helpful for that person. Then there's also Carbo-Veg, which has that same picture of being completely weak, debilitated, and exhausted. They also have that collapse and some fainting fits. But something that is noticeable in Carbo-Veg is the flatulence, meaning a lot of farting or air hunger. So if somebody seems to be in a really collapsed state, I know this may be funny now, but not so much when you're actually needing this remedy, and seems to be having sort of this bluish hue around the lips that is noticeable in somebody who hasn't been breathing very well. At that point, probably cyanotic. Then carbo-veg would be a really great remedy to stimulate that person's healing response to sort of relieve them from that state. Another great remedy during this time is veratrum. So veratrum album, which has also that profound exhaustion, collapse, fainting. So you notice the theme here seems to be any kind of collapse and exhaustion. You know how they talk about the shortness of breath, right? It's when you're so exhausted that even walking to the bathroom is exhausting. And hopefully you have toilet paper in the house. Shortage. It's an interesting situation. Anyways, so veratrum can be a useful remedy. Another great remedy, which brings us back to the remedies used in 1918, is bryonia and gelsemium. So gelsemium is a really great remedy that also has this drowsiness, this tired feeling, right? Which is quite common in a lot of flus when you're so exhausted and drowsy and you have this feeling of nervousness, this muscular incoordination, a little bit trembling, nervousness that can also be applied during times for performance or performance anxiety, as in when you're about to go on stage or when you are about to take a test. So that's when it's useful as well. And then bryonia, which I talked about shortly before, which has that dryness everywhere, the irritability, the bursting, stinging, aching, not wanting to be touched, not wanting to move. So that's bryonia. And then another remedy which can be useful in this situation is eupatorium, which relieves the pain in the limbs and the muscles. So for any kind of febrile disease like malaria or influenza, it seems to be really helpful because you get that bone aching, right? As if somebody is like squeezing your bones really tight. So that could be a very useful remedy if the symptom picture or the totality seems to bring up those kind of aches and pains.
All right, thank you so much, Dr. Schmidt. Final question for you, just to wrap it up. I know we have a mixed group on the webinar tonight, so some people may have never heard of homeopathic remedies before, and so this might be brand new for them. And on the other hand, we might have some people who use homeopathy quite readily in their home. For those people, this final question is oriented, and it's how to kind of conserve or save remedies to avoid shortages. And you showed the bottle, there's typically like about 100 pills in a bottle. So there's a lot in there, but if you're using them every day, maybe as you suggested for support, like how can we save that? And another point of note, I just wanted to mention, because Dr. Schmidt kind of made some recommendations for like general dosage based off of what she's learned, is that homeopathy is very safe. So these are very dilute medicines, and so there's no risk of side effects at all. So just another note there. But anyway, if you can address how people who are using homeopathy in their home already might be able to conserve the remedies. Go ahead. Thank you.
Yeah, so like I said earlier, part of how you can take the remedy is by taking 3 pellets or 8 pellets and putting it in a larger container of water and taking teaspoons of it. That way you'll be able to make a smaller 1 drum, or I believe this is a half drum actually, last a little bit longer. So one of the ways to make sure that it doesn't go bad is to put 10% alcohol, meaning not that the concentration of the alcohol is 10%. So if you can get a 180 proof alcohol, grain alcohol, that would be a really great one to start with. If you don't have that, then maybe rum. If you don't have that, then maybe vodka. Any of the unflavored alcoholic beverages that one keeps at home. You can put 10% of alcohol and 90% of distilled water. If you don't have distilled water, perhaps just regular water should be fine for short-term use purposes. And then take teaspoons of that instead of the small vial or the small dropper that one might be given. Now, if one has a small dropper, you can also do that and do the 10% alcohol and the 90% water and replicate it into a larger vial or a larger dropper in order to make that one last. Because homeopathy is formed through the process of dilution, every time you dilute it, it becomes just slightly different potency, meaning just slightly one potency up. Which I think for the purposes of long-term usage and changing of potencies might actually be helpful, especially if you're dealing with acute situations.
Excellent. Thank you so much, Dr. Schmittat. Next, Dr. Marie Rodriguez will present on lifestyle and mind-body methods that can be used to manage chronic stress. Dr. Marie truly believes in the body's innate healing wisdom and is passionate about helping others gain access to their inner power. She has been in naturopathic medicine practice since 2002 and has over 20 years of experience as a cranial sacral practitioner. As a fervent seeker and forever student, Dr. Marie's own personal healing journey led her to experience and study a myriad of energy healing modalities. Dr. Marie recognizes that the physical, emotional, and energetic and spiritual aspects of our human experience are all highly intertwined. She skillfully weaves the contents of her eclectic medicine bag to support people wherever they are on their healing journey. She is also a skilled artist, and I have her beautiful artwork in my office.
Oh.
She sees patients at the Viva Center in DuPont Circle, Washington, D.C., and also offers sessions over the phone and Zoom. And I'm pleased to discuss mind-body practices with you. Which mind-body practices do you find most effective clinically for chronic stress, Dr. Marie?
So I was going to talk about the techniques later, but we can just go that route now if you want.
You can.
I was actually doing one with EFT tapping, and that is probably like my #1 go-to for stress and anxiety in the office with people. You basically say an affirmation, and actually if I do it right now, I'm going to be a lot calmer during the presentation. So rubbing on these points here and saying an affirmation, even though I'm having a difficult time breathing, I completely love and accept myself. And you repeat it twice, even though I'm having a difficult time breathing, I completely love and accept myself. And then for the third time, even though I'm having a difficult time breathing, I completely love and accept myself. And then you go through a series of tapping points, holding that intention or that affirmation. I say about 8 times. So here, inside the eyebrows, outside the eyebrows, under the eye, near the nose, lip, back of the head, back to these points. Side of the ribs, you can't really see where I'm tapping right now. Wrists together. And then the karate chop point right here. So I think that happened for a reason. Now I feel better. So it's funny, when I went to school at Bastyr, I had a presentation on EFT my last year, and I was really kind of a cynical scientist back then. And I could barely even stand the presentation. I was like, this is ridiculous, hocus pocus. I just want to walk out of the room right now. And then 5 years into practice, one of my patients said that she cured herself of bulimia using EFT. And I said, okay, put my ego check, let's check that and let's look into EFT. And so I did, and I've been using it ever since. And I give it to most of my patients with anxiety. So that's something that anybody can use right now. There's a plethora of information on the internet, on Facebook, wonderful videos. It's very simple to use. And so I really encourage people to start to incorporate EFT. And what I originally planned to talk about this is what really has struck me the most with being kind of forced into this pandemic is that our lives have changed dramatically and suddenly. So we've lost a sense of normalcy And I felt myself going through these different waves. So initially it was, how do I help everybody? How do I help all my patients? How do I keep everything clean? Oh my gosh, I can't find any of these herbs for anybody. And there was like this, just this big adrenaline rush of resources, webinars, learn. And then I hit a pretty quick like adrenal crash. I thought maybe I have the virus. I'm not really sure what's going on. And so what I think we all need to realize is that we're kind of in for a marathon. Or Dr. Leah called it a gestation, but you can use that analogy as well. And so in a marathon, you really want to just conserve your energy, right? You want to be feeding yourself what is going to give you a lot of energy for the long haul. And so today I wanted to talk about what would be a good model for kind of getting us through this, this marathon. We don't really know what's going to be at the end of the finish line. I know a lot of people are putting their spin or their like channeled information about the pandemic. And I just feel like as long as I can help me stay in the eye of the storm and help my patients and my friends stay in the eye of the storm, or as Dr. Holland said, stay in our lane, that's what we have to do now. And I really loved what Dr. Leah said about we have ancestors who've gone through this. My grandfather was born in the Spanish flu and he's still alive. He's going to be 99 this weekend. We're probably going to have virtual, maybe have a Zoom party, but that might be a little bit too much technology stress for him. So he's hunkered down on his own and he's doing really well. And I think it's important to note that we do have this resilience built within us. And what we're seeing on TV, we're seeing the tip of the pyramid. At the bottom of the pyramid, the base, the big base, is the majority of people are mild or asymptomatic. And we just kind of have to remember that and take in what information you need to get through your day. I don't think we need to be flooding ourselves with all of this data. I think that too much information can actually be traumatizing in and of itself. There is such a thing as vicarious traumatization, so just witnessing what someone else is going through. I know that we want to be really good citizens and stay on alert, but right now our job is to physically isolate, to take all the precautions, and honestly, I think to be as positive as possible. And one thing that I'm noticing that I wanted to bring up is we've never had to isolate like this in such a quick period of time. And I found myself just getting emotional because I see all my friends on the screen in front of me and I was like, I haven't really interacted with people. And I had this really powerful experience with these two amazing women, Dr. Leah and Dr. Sarah. This winter, we spent hours and hours and hours together. And I'm like getting a little bit teary to talk about it. We're working for our licensure. And I'm seeing Leah and she's looking a little bit teary as well. And I think, going through this trauma with it, because this really is a collective trauma, what we're going through with this pandemic, is I tend to like hold so people can fight it out or they can flee. I'm someone I hold and I get through it. And so seeing them, I'm like starting to feel like I'm thawing out. Like I see these friendly faces and I'm like, I got to present and I'm going to cry. So anyway, not to go off too much of a tangent, I'm just sharing a little bit about trauma. What I originally was going to say is that stuff that's been underneath the surface, but that we have all these wonderful lives, it starts to bubble up. We don't see as many of the people that we are always, used to. We don't have the workout routine. I don't have my awesome yoga teachers. So all these different ways that we're either supports, resources, ways to help us cope. I can't get massage. I can't distract myself with, different things that I used to. So there's this other stuff that's kind of bubbling up. So in terms of us being in this marathon, how can we really take extra good care of ourselves?
With that,
I see a lot of posts out there. Oh, you have all this time. Why don't you write that novel? Or why don't you, do the 100-day burpee challenge? Why don't, and I'm like, okay, this is just like a furthering of this overachieving society. And I think it might be a message like, let's just, simplify right now. Let's just calm down.
Dr. Marie, can you talk about the concept of being grounded, why this is important now, and how we can stay grounded in such unprecedented times?
Yeah, so for me, being grounded is being connected to my body. So what does my body feel? What do I feel in my body in every given moment? What does the texture of my blouse feel like? Can I actually connect with my feet, as I'm speaking to you all? Or am I ahead of the pandemic? Am I thinking about, oh, how am I gonna, when I move my practice, what am I gonna put on that shelf? Can we actually just be in the moment, feel our bodies? And I also really think, how connected are we to nature? We are one with nature. We wouldn't be here if we didn't have a healthy planet to hold us. And kind of as a side note, nature's doing really well as a result of all of this. Pollution is way down. Mother Nature is very happy. So we can really ground ourselves by, spending time in nature and really noticing it's spring outside. There's beautiful flowers in bloom. I think connecting with our senses, aromatherapy is great. Herbal teas are great. So smell, touch, deep stretching, feeling like opening up the fascia. I love using a foam roller. Use that on my back, and I'll use that on my legs. That's really a great way to help keep me grounded. So just how are you physically present and connected to your body is what I think of with being grounded.
What about healthy boundaries? Can you share a bit about this and how this can be helpful?
Yes, I think boundaries right now are extremely important, especially as it comes to what we're being exposed to on the news. I think that we are a sensationalized and a spectating culture. And I don't really think that this is a time to be spectating and, watching interviews of people who've lost family members. I think maybe down the road, and I've been hearing this, I feel confident and comfortable saying this because a lot of my teachers are saying the very same thing. So boundaries, like think of your personal boundaries. So my home is my safe place. I have a little candle lit back there. It smells like grapefruit. The air smells nice and clean. How can I just make my home be comfortable and warm and nurturing, and keeping out what I can't control? I can't control what they're showing me on the news. I can't control whether or not people are physically isolating and distancing appropriately. I can't control other people's responses. So I'm just going to focus on taking care of me and then those who I interact with, my clients, my friends, my loved ones. And then having a good boundary also means saying no. So my sister sending me this stuff on, text, or a friend sending me some stuff. And I'm like, I feel my heart rate go up if I read the whole article. So I'm just, having to take a break from that. So it's a really good time to practice saying no, which I think honestly a lot of us caregivers need to learn how to do. So to me, that's what I think of healthy boundaries, focusing on what you can control and just keeping everything else outside. You can tell when your boundaries have been breached. I have a hard time falling asleep. I feel like I've taken on something that's not mine to carry. So that's what I consider having good boundaries.
Excellent. What about the idea of resourcing to help alleviate stress?
So we've talked a lot about plants as really powerful healers tonight. And so I like to use plants as an analogy. So plants need water, they need to be grounded, and their roots need to be in the earth, and they need sunshine. How are we really that much different? I mean, we talked about being grounded. Dr. Robert talked about the importance of hydration. I think exposing ourselves to, Dr. Sarah talked about how we need 15 minutes of sunlight a day. I think that the sunlight is such a powerful way to just give us energy, give us some really good nourishment, some good resourcing. We can nourish ourselves with foods, supplements, positive images, creativity. And I encourage people, I want to start doing this myself. I haven't put this into action yet, but maybe scheduling like a Zoom call with a friend once a day, or more video chatting, that kind of thing, because we need the physical connection to feel optimistic and to have energy. Once again, being out in nature, that's a really powerful resource for me. I feel so much better. If I haven't gone out for a long walk in a couple days, I just start to feel kind of gross, to be honest with you. I need to be outside regularly. any spiritual practice that you have, now is the perfect time. Keep doing your spiritual practices. Say your prayers, do your mantras, your meditation, read your text. Playing really lovely spa-like music in the background is very helpful. I enjoy doing that, or even if there's a healing mantra, there's lots of really great options on YouTube. And there's healing frequencies called the solfeggio frequencies that are just wonderful sound healing. So you can just be playing that in your space throughout the day. So some just good ideas on how to fill yourself up with some wonderful resources.
And what are some important things that we can do to support ourselves every day with that are good for immunity? I think you've mentioned some of those, but maybe a few more tips.
Yeah, so just I'm thinking about, like, you know, naturopathic practice, like lifestyle things that we want to cue in on. So sleep routine, sleep is critical right now, you guys. If you're not sleeping, we really need to get that corrected. Thinking of your adrenal support here, thinking about really unplugging, you know, 9 p.m. if we can. Every hour before midnight, we get so much more melatonin. So some people are staying up till like 1 or 1:30, just catching up on stuff, or, you know, reading articles, that kind of thing. But our sleep is really, really important for our immune system. So focus on getting that really, really strong right now. And I love doing legs up the wall. So I have a history of I had chronic insomnia for, you know, a number of years, and I learned a lot from that struggle. And so one thing that helps me a lot is doing legs up the wall at night. And I like to combine it with some vetiver and lavender essential oil, maybe an eye pillow, and I'll do legs up the wall for 20 minutes. I feel my adrenals really start to throb, and then I lie down and I get into a much better, you know, better state of rest. That's something simple. If you don't have access to a wall, even just like bending your legs up over your couch or over your coffee table, that's something that's pretty easy to do. Exercise is really shown to be hugely important and beneficial for immune function. So the recommended level is 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity, meaning that it's difficult to carry on a conversation when you're exercising. So moving your body, we store our stress in our body, we process our emotions through our body. So just getting for a walk, going for a walk outside, going to places that aren't crowded, that's really been a mainstay for me, is going for a really nice long walk almost every day. And then last but not least is, you know, further ideas for, you know, reducing stress, because stress, as we know, greatly lowers our immune system. So it lowers our white blood cell counts. So the EFT that I showed you, that's a wonderful tool to minimize stress. Creativity. If we have extra time now, I have a patient, a long-term patient, who literally healed herself from chronic anxiety by taking up art. She never thought she would ever be an artist. And so she began taking some painting classes and then really honed in on colored pencils. And she's fabulous with colored pencils. And she is a completely different person from taking up this creative endeavor. And then I will highlight again, the reducing exposure to the traumatizing news is going to be critical for reducing your stress. I can't say that enough. And you're going to have your boundaries up, because people might be wanting to like talk to you about things. And the last thing would be some deep breathing. Deep breathing has been shown to be really effective for calming the nervous system down. So we need to practice deep breathing. You need to do it for a sustained 20 or 30 minutes for it to have a great impact on turning on the parasympathetic nervous system. And you want to be doing it regularly as part of your routine. I've seen it be very effective for calming nervous states, improving sleep. And then we're talking about like the deeper abdominal breathing, and doing it in a manner that's like gentle and comfortable, not really forcing yourself to take a deep breath. So just slowly taking a deep breath and inhaling over time. And that's all of what I have for today. And know that we were going to do some questions, but I could also guide us through a breathing practice if we wanted to.
Thanks so much, Dr. Mee. I will have you guide us through a breathing exercise at the end. We do have a few questions, and if any of the other attendees have some questions they want to add, again, the question icon, you can type them in. We have two questions related to botanical medicine. So Brian, the first is, do you recommend taking elderberry daily or only when you get sick?
Right now, I would say daily is perfectly fine as long as it's not too expensive for you to do. To use it as a preventative isn't the worst idea right now. And if you want to save your money and only use it at the first sign of illness, that's the best way to use it. It's the most common way it's used.
And then there was a blue plurum question mark. And that's the question. Blue plurum question mark.
Question mark. It's a good question. So blue plurum is its species name is Blue plurum falsatum. It's a plant that grows in Asia, and it's one of the ones that in the herbal protocols that are being used in China, blue plurum is being featured very heavily as like one of the ones they're using a lot. So expect to see a little bit more talk about that if you follow plant medicine news, or if you're like, oh, what's interesting about that?
Awesome. I want to take any other questions. I'm going to give people a moment, but while people are maybe taking a moment to think about their questions, I just want to thank everyone for participating and for your thoughtful engagement. Again, I want to thank my colleagues for taking their time this evening to spend with the community here and to share their insights on how we can all support each other and support our immune health and resiliency during this stressful time. And also, I do want to let everyone know that most of our naturopathic doctors here in Virginia are continuing to see patients through telehealth during this time, and we'll be glad to be supportive to you and your families during this time and after this time as well. So we're here to be a resource for the community, and we're happy to do so. And I don't see any other questions. I'm going to go ahead and pass it back to Marie to lead us through a breathing exercise that we'll close with.
So this breathing exercise, I've kind of adapted it. There's a breathing exercise that's called 7 for 7. So breathing, inhaling for a count of 7, holding for a count of 7, exhaling for a count of 7, holding for a count of 7, and then doing a series of 7. So we're going to do instead 5 for 5. And if you find that you can't, and you just do it to your level, because we are in a pressure time right now. So you might be inhaling for 3 and holding for 3. So let's just kind of get comfortable in our chairs, close our eyes, just connect with our feet and our bodies. Maybe you want to put your hands on your abdomen. If you feel called to put one hand on your chest, you can do that. And just imagine that you're in your own safe space. Maybe you're in nature. Just feeling grounded and supported. And the only thing that's around you is what is nourishing to you, whether it be the sunlight, the trees, the flowers. So just kind of envisioning your safe space for a couple breaths. And just setting an intention to bring in a lot of positive healing support, and then also an intention to just release anything that really isn't supportive for us right now. So when you take your first breath, just slowly inhale, just letting your abdomen inhale slowly. I'm going to count for us. And then hold that breath. And just begin to exhale slowly. And then hold again. Begin your next inhalation. Hold again. Exhale. Hold again. Take your next inhalation. Hold again. Exhale. Hold. Inhale. Hold. Exhale. And I believe that completed 5. So hopefully we all feel a little bit calmer as a result. Thank you so much for organizing this, Dr. Sarah, and wishing everybody health through the rest of our journey here.
Thank you so much. I do feel so calm and just really grateful for my community of naturopathic colleagues and patients, and for everyone else, and for Baron Glasgow. Thank you, sir, for organizing this for us. He's our executive director, and we really couldn't do our work without him. For those of you interested in learning more about naturopathic medicine in Virginia, please do check out our website. That's www.vaanp.org. You can learn more about the wonderful naturopathic doctors that are throughout Virginia and our efforts to bring more access to naturopathic medicine for patients throughout Virginia. And we are very active in those efforts. Thank you so much, and have a wonderful night. And June 10th is around the corner, guys.